Hi there, my name is Emilie Sleight and I'm a postdoctoral researcher at the CIBM Center for Biomedical Imaging in Lausanne, Switzerland. I work on a 70 MRI scanner, which is a strong magnet that can be used to detect small pathological features such as tumors. If a patient with tumors comes in every year, we would like to know how the tumors evolved across the years, and to do this, we use a quantifiable parameter called T2. T2 corresponds to the time constant of the MRI signal decay, which is different for each tissue and gives the image contrast when the image is acquired at a specific time point. One way to measure T2 is to acquire images at different time points and model the signal decay. However, to acquire an image, we need to apply a short oscillating magnetic field called a pulse, and we need to apply such a pulse before each image we want to acquire. These pulses at 7 Tesla have high energy, and therefore their use is restricted for the safety of the subject in order to avoid heating tissues. What I was working on recently is to reduce the energy of the pulses by reducing their amplitude. This creates a jitter in the signal decay that can be modeled by the so-called extended phase graph. Here are the amplitudes of the pulses that I have found after optimizing them so that I can still measure different T2 decays. When I used those lower energy pulses to measure T2 in the brain, the images had good quality and repeatability. However, they were slightly more noisy in some brain regions due to locally low signal intensity. Also, the T2 values were overall lower than in images acquired with high energy pulses. Next, I will investigate where this difference comes from by using an object with known T2 values. I hope you now have a good understanding of what my work is about. Thanks for listening.